why the mouth matters. That is systemic link between mouth and your systemic health. Why does the oral microenvironment mirror systemic biopathology with such striking fidelity? It boils down to your distinct, unsellable biological mechanisms. First, accelerated epithelial turnover. While the epidermis requires 28 days to fully renew, the oral mucosa turns over in just 7 to 14 days. This hyperproliferative rate makes it immediately vulnerable to any systemic wide disruption in DNA replication, protein synthesis, or cellular cofactors, which is exactly why deficiencies in iron, folate, or vitamin B12 unmask themselves in mouth first. The filiform papilla flatten, the mucosal barrier thins, and ulcers emerge early. Secondly, the microvascular density and attenuation. That is, the subvitreal lamina propria is packed with an extensive capillary network over thin non-keratinized zones like the floor of mouth or ventral tongue. This attenuated barrier allows us to instantly visualize systemic vascular and hematological states. Whether that is the extreme pallor to severe anemia, the peteche of thrombocytopenia, or the icterus of hepatic failure. Third, immunological activity. The mouth experiences constant antigenic exposure and contains active mucosa associated lymphoid tissue, that is MALT. Crucially, the major extracellular antagonists targeted in systemic disease, such as desmoglein or basement membrane proteins, are heavily expressed here, making the mouth the initial battleground for blistering autoimmune conditions. And fourth, salivary reflection. There is saliva is a complex ultrafiltrate of serum. When systemic blood glucose rises in uncontrolled diabetes, salivary glucose tracks right along with it, altering local microbiology. In the literature, it is clear that in the Lancet that there are more than 100 systemic conditions present distinct oral mucosal manifestation, and we are not simply treating a localized oral environment. We are serving as a frontline defense for your systemic health. Thank you. This is why the mouth. It means there is systemic mapping, that's oral biology connection between systemic health and your oral health. There is a bidirectional clinical interface of the oral microenvironment. That means if any systemic disease occurs in your body in subclinical way, they first show the sign in mouth, such as hematologic disorders and any malignancies and cancers, nutritional deficiencies, endocrine deficiencies such as diabetes mellitus and Addison disease, like in all others like autoimmune disease and infections like syphilis, HIV. All show their signs early in the mouth before they appear in systemic health. So that you have to know many details about the systemic health that show the signs in mouth, and first dentists or oral surgeons and any dental professionals would be the first to see and diagnose any systemic disease before they go to severe conditions. So do not neglect the such lesions that can be diagnosed with oral manifestation. Thank you.